When we make the diet like a pyramid, so there is a pyramid, you have the maximum portion as the fiber, and then next is constructed with the protein, the next is constructed with the pulses, and the next is constructed with the cereals, and then comes the simple sugars.
Welcome to Health Inside Out, a Kauvery Podcast. Thank you so much for joining us on Health Waves by Kauvery Hospital. Today, I've got Dr. Hemkumar with me, who is Consultant Internal Medicine, Kauvery Hospital's Marathali. Sir, thank you so much for coming to the Fever Studio.
Hi Shaheen, thanks for having me in Fever Studio.
It's such a pleasure. I know doctors are really busy. I am thankful that you've given us your time. Can you kindly introduce yourself a little bit more for our listeners? What is internal medicine? Yeah.
I'm Dr. Hemkumar. I'm Consultant Internal Medicine. Internal Medicine or otherwise General Medicine. We are physicians. We deal with the medical issues of our patients. When we say medical issues, it comprises everything like endocrinology, diabetology, infectious diseases, and hematology. So many subspecialties are there in internal medicine. So we don't deal with these specialties, but we deal with the patients, anybody entering to the hospital with a medical problems. So we are the first point of sentries for those patients, and we try to diagnose their problems, and if it can be sorted out by ourselves, we do that. Otherwise, we refer them to the super specialties.
All right, sir. We've got quite a few things to talk about. Let's start with something that a lot of people deal with, that is diabetes. Now, there is a term called diabetes reversal. What is diabetes reversal? Is that even possible? Sounds too good to be true.
It does sound too good to be true. We don't call it as a reversal medically, yes. For a layman, yes, we can call it as a diabetes reversal for all practical purpose. But in reality, we go for something called as a remission. So remission is we don't require medications. We do some sort of interventions like diet, lifestyle. These are the primary interventions in diabetes. And these patients who go for a very strict diet, change their lifestyle, are well motivated, do regular exercises, lose weight, and lose out all the calories, extra calories in their diet, many of them go for a diabetes remission. So they would not require medications, but they have to maintain their lifestyle to remain non-diabetic for their lifetime.
All right. Now, I know that pancreas has got something to do with blood sugar. Can you explain that process to us a little bit? How does pancreas come into play? What is its role, and how does it deal with blood sugar?
Yes. Pancreas is a organ which is lying just behind the stomach and below the lungs, heart and the spleen. It is just lying in the center of our body, almost just next to the solar plexus, if you are aware of that. So this organ has two functions. One is digestion, that is what we eat. The fat and protein are digested by the enzymes, that is a fluid secreted by the pancreas. And the second function is metabolization of these simple substances like carbohydrates when they are entering into the bloodstream. So that is the energy currency of our body. Glucose is the energy currency of our body. How this energy is being utilized in our body, whether it is getting burnt, whether it is getting stored, whether it is getting converted into any other energy forms like protein or fat, are decided by some hormones. The first and foremost is insulin. The second is glucagon. So these two hormones are secreted by the pancreas, rather the tail of the pancreas. A small portion of the pancreas secretes these two hormones. So that's how the pancreas plays a very important role in diabetes. The pancreatic dysfunction causes diabetes.
All right. We always hear about weight loss being, kind of key to diabetes reversal. Is losing weight really the only way, and does it matter that much in reversing diabetes?
It's not the only way, it's the most important way. For example, when we talk about diabetes, we are having two types of major forms of diabetes. Let me be clear about that. Type 1 diabetes is not curable, not treatable by anything else other than insulin, where the pancreatic portion which secretes insulin is completely dysfunctional. It doesn't work at all.
Oh.
But there is type 2 diabetes, the commonly prevalent diabetes, what we see nowadays in huge number, epidemic proportions, is type 2 diabetes in India. So this type 2 diabetes is caused by, one is a slight dysfunction of the pancreas, two is resistant to the insulin which is secreted by the pancreas. This resistance, insulin resistance, is primarily caused by weight and lack of physical activity.
Okay.
These are the two things. So that's why losing the weight is a very important cornerstone in treating the diabetes. Whether we are reversing it or not, losing weight will help in managing our diabetes much better.
Okay, now I also hear about something called pancreatitis.
Yes.
Right? So when a person has pancreatitis, how does it affect their ability to manage diabetes for that matter?
Yeah, pancreatitis is nothing but inflammation of the pancreas. Either it gets infected by some viruses, or it gets inflamed or injured by the juices of the pancreas itself.
Oh.
So this is pancreatitis. So when this happens, the tail of the pancreas also gets involved, and the insulin secreting cells which are present over there, they get damaged. Some of them develop diabetes, but they behave more like a type 1 diabetes rather than a type 2 diabetes.
Okay.
So they are also not reversible, and most of them will require insulin replacement as a therapy.
All right, and that is a permanent thing, insulin replacement, or is that a temporary?
Possibly type 1 diabetes and pancreatitis induced diabetes also, most often it is a permanent thing.
Okay, all right. What are the most common mistakes that you say people make when trying to reverse diabetes, and how can they avoid falling into that trap?
First, we should understand how much weight loss is required and what we should restrict and what we should do, do's and don'ts primarily of diabetes reversal or remission. So weight loss, when we say about 15% of weight loss from whatever the person, when they start the diabetes reversal or remission journey, about 15% of weight loss will cause a good remission of the diabetes. Means the measuring parameters are 3 parameters usually. We see the blood glucose when they are not eating anything, that is a fasting state, around 8 to 10 hours they have not had food, and we check the blood glucose level. And 1.5 to 2 hours after they eat the food, we check the glucose levels. These are 2 parameters. And then there is another milestone called as HbA1c, or glycosylated hemoglobin. So this is a slightly newer kid in the block in measuring the diabetes control.
Okay.
So past 20-25 years it is widely vogue, but has been in and around for past 30 years.
Okay.
So when we are controlling the diabetes, so reversal of diabetes is called as when the HbA1c comes to the normal range.
Okay.
And the fasting and postprandial glucose also comes to the normal range. So when we are doing that, the do's are, so try to do it in a very gradual manner.
Not crash dieting.
Not crash dieting. Say people lose weight. So because when we do crash dieting, most of the weight loss initially is water loss. We get dehydrated. So that will cause much more difficult changes in our blood, and also injury to the vital organs like kidney and liver. And using meal replacements.
Right.
And these meal replacements should be devised for each person's workload. So no two people have a similar exercise or similar work life. So somebody might require a little higher calories, somebody might require slightly lower calorie. Somebody who is physically very active will require a little higher protein content. Somebody who is not into physical activities will require more fiber content. So these things has to be clearly defined by a team of physician, diabetologist, endocrinologist, or along with a nutritionist and a trainer who takes care of their exercise schedule. and also very close monitoring how they behave, because very high sugars initially should not be treated only by sudden weight loss. So they might require medication for a duration of time to avoid such complications. So if we just crash diet, we may land up in much more complications and end up in the hospital faster than we expect.
Okay. We know that when a person is suffering from diabetes, the stuff they shouldn't eat, right? Unhealthy foods, they shouldn't eat a lot of sugar. Are there food items that can actually help in reversing diabetes or, taking care of the situation? Any particular food item you suggest to people?
So there are no magical food items. So like the Kung Fu Panda, I think there is nothing magical over there. So there is nothing special over there.
Right.
We are cutting down the calories. There's more fiber in it. The more protein in it. The lesser carbohydrate, particularly simple carbohydrate in it. This is the diet which is good for diabetes. In general, if we say vegetables, green leafy vegetables, and fruits, not the juices, even without sugar. Many people drink juices and feel that fruits are good,
right,
and then we will drink juices, because when we take a juice, we just take the sweetest part of the fruit and we leave out the fiber. Which is very good for the diabetes out. So vegetables in the first place, and then the fruits, and then lean meat, and then the pulses, dal and things, besan, like these things. So these should be like, when we should make the diet like a pyramid. So there is a pyramid. You have the maximum portion as the fiber, and then next is constructed with the protein. The next is constructed with the pulses, and the next is constructed with the cereals, and then comes the simple sugars.
Okay. I have heard a lot about jaggery, using, a lot of people nowadays, they try to replace sugar with jaggery, or for that matter, honey. Does it work, or is it just a fad for that matter?
Anything which is sweet, tasty, is going to have simple carbohydrate in it.
Okay.
So any food which is very sweet or salty will have either a simple sugar or a simple salt in it, sodium chloride. Otherwise it will not. The exceptions are the artificial sweeteners we get nowadays, like sucralose, like saccharin and all those things. Excepting this, these are all 0 calorie sweeteners. So excepting this, all the other sugars are all same only. White sugar, brown sugar, natural sugar, country made sugar, jaggery, palm sugar.
Right.
So whatever you say, all are sugar only. So maybe a 5% difference in the calorie value of each, and 5% difference in the nutritionist value. Otherwise, they're all same.
All right. And I have actually a couple of questions to ask you, which is beyond the scope of this as well. And that is, when you talk, these various brands sell these kind of drinks, right, which promises that this is a 0 calorie drink, and they use artificial sweeteners, so there is no sugar in that. How healthy are these? Let's say I'm on a diet. Let's say I'm watching the calories. Would it be advisable for us to drink those?
It won't be advisable to drink.
No, in terms of, let's say, to satisfy your craving.
So if you want to select a drink with aspartame, so for example, most of these soft drinks comes with aspartame as a sweetener. If you want to select a drink with aspartame or a sugar, I would say aspartame is better. But in general, the soft drinks, what we talk about, the colas, have lots of other substances which are not good for our health. They have phosphoric acids, lots of acids over there. But it's okay once in a while, say for somebody who is a diabetic who wants to take it once in a month, I think that should be okay. But it is not that
couple of times a week?
No, I don't think so. I don't think so. Means there is no specific levels. I would say that this is fine, but as an occasional thing, it should be fine. So we should not make it as a habit that since it doesn't have calories, it is good. It doesn't mean like that.
All right. Okay. For those who've had diabetes for years, is reversal still an option, and what realistic results can they expect if they make that effort?
Duration of diabetes, when we say if the control has been reasonably well, if they are their lifestyle is still not adequately addressed, still there is a scope for those people. Otherwise, they can come 1 or 2 levels down on their medications. These efforts, somebody who is on insulin may go out of insulin. Somebody who is on 3 or 4 different drugs may come down to 1 or 2 drugs. But the duration beyond 5 years, 7 years, it usually doesn't happen like that. But within 5 to 7 years, I think if their lifestyle is still lots of things needs to be addressed, they are obese or overweight, I think there is a scope for them to attempt that.
Okay, I'm going to ask you a couple of questions which is beyond the scope of this interview again. One is, since you specialize in internal medicine, what are the most common complaints that you see people come to you with nowadays? Let's say, is it dengue? Is it something else? Most common complaint that people come to you with?
Presently, it is a fever.
Fever.
Fever with joint pains is the current past 3 or 4 months that has been the problem. First, second is
And that is because of dengue or is it because of viral fever?
dengue, even chikungunya, we are seeing a little rise in the numbers.
Okay.
Other non-specific viral illness, we call it as dengue-like illnesses or fever with joint pains. So that has been on the rise for the past 3 months, as along with the monsoon rise.
Okay. And that will stay till the monsoon is there?
Possibly, yes. Till the temperatures go down, mosquito population comes down, this will remain for in the higher levels.
All right. Okay. What do you suggest to people to avoid, the viral or dengue-like illnesses, viral fever? What do you suggest people should do?
Avoidance of mosquito bite is the first thing. So dengue, chikungunya is spread by Aedes mosquito, and these mosquitoes usually bite in the daytime. They travel very short distances, and they breed in water which stagnates just after the rain, not the drainage water, the water which stagnates in and around our garden and in discarded plastics, buckets, tires, all those things. So avoiding these mosquito bites will help in preventing these infections. So avoid, whenever we are going outside, wearing a full sleeve, using a mosquito repellent, creams, and trying to close the windows, use the nets, and use mosquito repellents, sprays, or the liquefiers, also the vaporizers. So whatever the methods we can do, try to avoid the mosquito bite, and then drink clean, boiled and cooled, clean drinking water. These are the 2 primary sources of these viral illnesses.
Okay, one more question before I let you go, and this is good, a little difficult maybe, but one health myth that you would want to dispose of or do away with. A lot of people come and tell you, this is what I've read in Google, this is what my friend told me.
For dengue, probably papaya leaf.
Oh, that's a myth.
Yeah, that's a myth. So we even say 10-15 years back, when the dengue epidemics were endemic, it became endemic here, and yearly we used to face the dengue with low platelets, dengue fever with low platelets. We used to think that it might help, but I don't think there is any truth to that.
Okay.
So most often it creates problem by creating tummy pain, loose motions, discomfort, vomiting. So it confuses us whether the patient is worsening with the dengue or with this papaya leaf.
So that's not advisable for that matter. All right. Dr. T.R. Hemkumar, thank you so much for being here. Thank you so much for giving us your time. It was a fantastic interview. We got a lot to learn. And once again, thank you so much for coming to the Fever Studios.